To go live and we are live. All right. So my
Fantastic.
hello Dialogue with Khuraira fans. If you're new to this platform, Dialogue with Khuraira is about it's an avenue to share the incredible people doing incredible things in various communities for the betterment of humanity. We call them the unsung heroes. Why are they the unsung heroes? They could be doing things in your area, but because the spotlight is not on them, you might not even know who they are. So we go through social media, we go through our contact with people that have done charitable work and really find them and share their stories. And some of them, apart from giving back, they're also experts in their fields. And we take advantage of that to bring such people so that they can educate you either about your health, about financial growth, whatever it may be your concern. We find different people. Today, we have Dr. Adamu Al Hassan Umar, who is an expert in the cancer world. And as if you know, if I'm sure with all the things that is going on, one way or the other, you must have been touched somehow with someone that had gone through that ordeal. So, welcome, sir, to Dialogue with Herrera. And please introduce yourself, and then we'll ask questions. And hopefully, we have time today for also our viewers to ask you questions as well. So, welcome to Dialogue with Herrera.
Oh, fantastic. Fantastic. Thank you very much, Khuraira, for having me on this show. Very good afternoon to you. Very good afternoon and good evening to our viewers. I'm excited actually to be on this show today. Let me briefly introduce myself. As rightly stated by the anchor, my name is Dr. Adamal Hassan Umar. I'm a public health physician, and I am the president and the chief executive officer of the Nigerian Cancer Society. The Nigerian Cancer Society is a coalition of all cancer NGOs in the country, all cancer advocates, cancer survivors, clinicians, everybody. So everybody that has something to do with cancer is under the umbrella of the Nigerian Cancer Society, and
Wonderful.
that is the society that I head. I am a graduate of medicine from the University of Maiduguri. I graduated in the year 2004, and I have three masters in my kitty. I have masters in health planning and management, in international affairs and diplomacy with the Yobe State government. Now, I have been in cancer advocacy for over 23 years. I started when I was in medical school as way back as the year 2000, and I have been in this advocacy journey ever since. So yeah, you can call me an expert in cancer advocacy. You can call me an expert in cancer
Yeah.
because we have been around cancer for quite a long while, and that is what we do. So
Yeah.
I'm once again glad to be here, and I look forward to a robust discussion this night.
Thank you so much. I know you are super busy, and honestly, when you accepted to be part of Dialogue with Horara, I was very, very happy. Like I said, this is a very important topic for many people, not just in Nigeria, but across Africa, because right now, this killer disease is just all over. So, my first question is what caused the rise of cancer in Nigeria? If you could share that.
Well, thank you very much for that question. And let me say this before I go into answering your questions.
Yeah.
Of recent, we have had a rising increase in the cases of cancers in the country,
Yeah.
and in fact, within the first 3 months of this year, around January to March this year, there were so many number of cancer deaths that were recorded, so many number of cancer cases that were recorded.
Mhm.
Now, the reason for the increase is as a result of diagnosis, because a cancer case is a cancer case when it is diagnosed by a physician, by an orthopedic oncologist,
Yeah.
and undocumented cancer cases are not captured in the statistics. So what I usually tell my fellow advocates is that when we
Yeah.
see a rise in the cases of cancer, it's supposed to be actually some good news to us, because it means that there is actually awareness creation, and people are becoming more concerned about their health. People are becoming more interested in going for screening. So
Yeah.
definitely, you will have a rise in the increase in the number of cancer cases that we see. But
Yeah.
largely in Nigeria, even with the rate of cancer cases we record, an average of 120,000 cancer cases in each year, and we record about over 70,000 of cases
Wow.
that are dying. Now, this
Yeah.
is about 60% of all the cancer cases that are recorded that usually die, which is very sad, which is very
Yeah.
worrisome to us in the cancer advocacy space,
Of
because
course.
our intention, or our foresight, is to see a reduction in the burden of cancer. Now,
Sure.
for every one cancer case that you see, there are hundreds out there that are not actually captured, because they are
Wow.
not diagnosed. They don't come to the hospital. And we have this very high number of mortalities, very high number of people dying from cancer,
Mm-hmm.
because of late presentations.
I
Because
see.
late
I see.
presentation is actually the major culprit, in
Mm-hmm.
the
Mm-hmm.
reasons why we have so much number of cancer patients that are dying. Because the reality is that close to 80% of most cancers are either preventable or curable.
Wow.
Close of over 40% of most cancers are preventable
See, I
when
don't
we
think
pay
people. I
attention to
don't.
our health,
People know.
when we pay attention.
I think a lot of people don't
Sorry,
know of
hello?
that. Nete, a lot of people don't know of that. People think that when you hear
Exactly.
this word, that's the end of life.
Exactly.
So that is what is my next question.
Exactly. Exactly.
That's what actually my next question is.
Okay.
What is put in place to address this rise?
All right.
Because we know that its early detection is very important. What is a Nigerian government
Very
or
important.
stakeholders are doing to address that rise?
Now you see the major weapon that we have as advocates, is to increase awareness.
Okay.
Because when you are informed, when you are educated on the dangers of late presentations of cancer,
Yeah.
you will be very you know worried, or you will be concerned to
Yeah.
seek for healthcare early. Now,
Hmm.
we have a very compounding factors in Nigeria, because the reality is that uh, many patients or many people may want to go for screening, but now where is the screening? Where is the screening service?
That is a
A lot
huge,
of our primary healthcare centers
a
in
huge question.
Nigeria are not equipped to do simple screening tests. Most of the screening tools are not available. So even if you want to go for cancer screening, you discover that you don't have where to go to do that. Now,
Okay.
a lot of cancer cases are detected, incidentally, you know, during other reasons, for other reasons. People going to the hospital for other reasons. For example,
Yeah.
a woman that has ovarian cancer, for example,
Hmm.
the ovaries are in the abdomen, and
Yeah.
ovarian cancer is one cancer that actually camouflages, that hides. If you are not the type that usually go for routine screening every year,
Yeah.
before you have ovarian cancer symptoms, it will have reached maybe stage 3 or 4. It
Wow.
must have reached that extent of having a tumor that is
Mm-hmm.
encroaching on your abdominal organs, that is pushing
Before.
your stomach up to the extent that you eat very little food and you are full.
Ah,
And when you eat very little, you are
that
full.
is
Then
fibroid.
these reasons will now take you to the hospital, and before you know it, doctor will say you have stage 4 ovarian disease. So that is actually the problem. problem that we have in Nigeria. But of course, government in its wisdom is applying a lot of modalities, to address the issue. And then of course, if you notice, the awareness spectrum in Nigeria has increased so much. A
Yes,
lot
I
of
have noticed.
non-governmental organizations are doing very well
Mhm.
in educating the local people, in educating
Yes.
the public, because education is key. When you
Okay.
consider that about 60% of Nigerians are illiterate,
Mm.
and about 60% of Nigerians are living in rural areas.
True.
And
Very true.
again, you discover that about the same percentage are living below the poverty line. So the problem is they are trying to put food on their table.
Yeah.
Seeking for healthcare is not actually the reason. And there is
A
this common
priority.
saying, in
Yeah.
our local parlance, that abunda, yes, that you don't go and look for trouble when there is no trouble. People are have that mindset. But of course, awareness is increasing, and
Yes.
definitely when you have awareness everywhere, you have people keen into the concept of going for early screen, not even going for early screen. Even a local woman can be taught how to effectively do self-breast examination.
Mm-hmm, mm-hmm.
And from self-breast examination, that is when you have, you can discover a noodle, you can discover a growth when it is benign, when it is not even a problem, and of course you can easily go and get it removed. We call it fibroadenoma. It's not cancer,
Yeah.
but it's something
Yeah.
that if left untreated can transform into
You can
cancer. Yes.
transfer to cancer.
So again, like the Nigerian Cancer Society is going
Mm-hmm.
into partnership with the National Health Insurance Authority, and there
Wonderful.
is a plan in motion to create six regional cancer screening centers, at least for the common
Wonderful.
cancers that have screening modalities like breast cancer,
Yeah.
cervical cancer, prostate cancer, and some other cancers that have direct screening modalities. For cervical cancer, for example, there is a precancerous stage that
Yeah.
before it becomes cancer, if detected, can easily be treated. In fact, it can be
Really?
treated at the point of screening. Yes, it can
Wow.
be treated at the point of screening, you know. So, but the
So I
reason
would
is
think
now
that
you had this,
awareness is key. So in terms that's takes us to
yeah,
the next question. What methods are
yeah.
being used for cancer awareness at the moment that you feel is effective, or
Well,
you feel you can recommend to do better?
well,
What
yeah,
areas?
yeah. Well, you see, talking about cancer in itself,
Yeah,
is a big form of awareness.
great.
We are in this studio today talking about cancer. Definitely somebody will develop the mindset of saying, okay, let me go and screen myself, let me go and do pap smear. Okay, I'm above
Yes,
40 years, let me go and do mammogram,
yes.
so that I can know the status of my breast, so that I can know, fecal occult test. There is something we call FOBT, fecal occult blood test.
Okay,
There is a amount of blood that appears in the stool for patients that have colorectal cancer, that
okay,
at the very early stages, when this blood can be detected, so somebody from a simple screening test, for example. Somebody
yeah,
from this discussion will form the habit of say, let me go and learn how to do self-breast examination. And of course,
yeah,
there are a lot of our organizations that are located in the grassroots that are doing a lot of campaigns. A lot
great.
of campaigns. Educating the local people, educating the local populace. A case in point is the human papilloma virus vaccine that is being introduced in Nigeria.
Yeah,
Now, it will surprise you to know that infection with the human papilloma virus vaccine is almost 100% the causative agent for cervical cancer.
really.
Now, yes, and
Can you
once
can you mention that again so people can catch it? Can you mention that?
yes, human papillomavirus vaccine.
Yeah.
I
Uh-huh.
mean,
Yes.
human papillomavirus, causes cervical cancer, causes oral cancer, causes throat cancer, but the major culprit of human papillomavirus is cervical cancer. Now, if young girls and boys between the ages of 9 to 14, before their 15th birthday, can
Yeah.
have human papillomavirus vaccine, if they can have human papillomavirus vaccine, it is a sure protective way against cervical cancer.
So,
But it
doctor,
will surprise you to know that,
yeah.
yes.
So while you are saying that at 15, is it
So it will
possible
surprise you to
another?
know.
Yeah, go ahead. No, what I was trying to say,
Sorry.
you said
Yeah,
at
yeah.
15.
What I'm saying is that, yes, nine boys and girls,
Yeah.
are supposed to
Yeah.
receive human papillomavirus vaccine
Okay.
between the age of 9 to 14. The ideal is that even a woman that has not gotten exposure to sexual intercourse, even at 25, it can be taken
Yeah.
up to the age of 25. But
Okay.
the idea is to have the vaccine before the onset of sexual intercourse, and that
Okay.
is the reason why
I see.
boys are actually the carriers.
Oh,
Boys are actually the carriers. So that
okay.
is why the target is to vaccinate boys and girls. But the sufferers are the women. Now,
Okay.
this is why the current human papillomavirus national vaccine rollout that will happen in Nigeria on the 24th of October is targeting girls, because
Okay.
they are the major sufferers. They are the target for the first phase of this vaccination exercise, because I think we have only about 8 million doses, but of course more doses will be procured in future, and there is a plan to even have it for boys, I think within the next few years, to be included as part of the routine immunization. So what I wanted to say is that because of the myths and misconceptions about cancer,
Yeah.
there were a lot of narratives that were going contrary. You know, some people are coming out to say this vaccine is targeted at creating infertility. That if you allow your girls to be
See?
vaccinated, it
Yeah.
will prevent them from. Yes, there are a lot of these narratives. We
Remember
are
that
we are
issue with
on
the
daily basis
polio?
trying to create counter narratives, to checkmate. Yes,
Yes.
yes, and this is a vaccine that has been available in the market, and they come in different forms, like the one that will be rolled out in the national campaign, Gardasil
Yes.
4. Gardasil
Yes.
4 protects against four four species of the human papilloma virus. These four species are the culprit species identified that causes cervical cancer in women in Africa, or let me say in Nigeria. So this Gardasil 4, there have been to
I'm
buy it
learning
over.
something today. This is
Yes,
unbelievable. No.
to get it, to get the educated parents are going to get this vaccine with their money to
Yes.
vaccinate their kids. you know a dose of this vaccine costs between 25 to 40,000 naira, and parents that know the consequences of
Of
cervical
over.
cancer are
Yeah.
buying these vaccines for their kids. Now we have a national rollout. It's going to be free of charge. All you need to do is to bring your girl child for vaccination. But people are still going around because of the myths and misconceptions associated with cancer, because of the African mentality in us, that
Mhm.
anything coming from outside is something that has a hidden intention.
Yes. Yeah.
We are
Oh,
battling every
they're
day to
trying to
counter
stop
these
us from
negative
having
narratives,
children.
that
That
this
is usually the case. They
vaccine,
always say they are doing it to
yes,
stop us having children. So I think
yes, because
something,
every 3 minutes.
yeah.
Yes, every 3 minutes, a woman dies of cervical cancer in Nigeria. Every
Allah.
3 minutes, a woman
Wow.
dies of cervical cancer in Nigeria. And it will surprise. Yes, every 3 minutes. As we are having this show, we're about 20 minutes into this show now. At least 6 women have died of cervical cancer. That is the extrapolation of the statistics that we have. And you can hardly
And
find
this is preventable.
cervical cancer survivors now.
And this is preventable.
Sorry?
It's just about awareness.
Sorry?
I said this is preventable. It's just about
Highly,
awareness.
highly, highly, highly preventable. Highly preventable. Like I said, this is why, WHO, because of the concern and the rising cases of cervical cancer, introduced the WHO strategy for elimination of cervical cancer by the year 2030. Now we call it the 90-70-90 target. It is
Okay.
expected that by the year 2030, if this 90-70-90 target can be achieved, it will go a long way in eradicating cervical cancer. 90% of women to be screened, 70% of identified precancerous lesions to be treated,
Okay.
and 90% so 90% to be screened, 70% to have human papilloma virus vaccine of girls, young girls,
Mhm.
90% of the precancerous lesions, we
Will be
are
treated.
on the road to eliminating cervical cancer in the country. I was in Rwanda earlier this year,
Our viewers, bear with us. Network is kind of
and
glitchy
Rwanda,
where Dr. Al-Hassan is. But
probably because it's
please
a
don't
small
go away.
country, probably
Yeah.
because it's a small country. Hello?
No, I was
Yeah.
just telling the audience that your
Probably because
net.
it is a small country.
Okay. Go ahead. Just
Yeah, I
keep talking.
noticed that. I noticed that.
Yeah,
So
just keep
probably
talking.
because Rwanda is a small country, and
Yeah.
they have a very good health system. They are on the road to eliminating cervical cancer. But we can do same in Nigeria. All we need is the political will on the part of government, funding for healthcare, commitment on the part of stakeholders, and then cooperation and, of course, understanding of the local populace. And it's only awareness that can, eliminate these myths and misconceptions. In my locality, for example, you have this attitude of people saying that if it is cancer, don't even make an attempt to go to the hospital. And I always have an example because I have seen 1, 2, 3 more cases
Yeah.
of things that are not actually cancer. You know, there is a common infection of the skin, infection of the muscles, the muscle
Yeah.
tissue.
Okay.
In surgery, in medical parlance, we call it necrotizing fasciitis. Now,
Okay.
it is a process of, you see, the muscles, it will be eating the muscles, it will be eating the muscles, and if care is not taken, it will infect the bones. And ultimately, patient will die because of what we call septicemia, meaning that there's a
Yeah.
generalized infection because this local infection is not treated. Now, if a patient develops that necrotizing fasciitis in most of our villages, they will say this is cancer, it's jeji. So
Yeah.
don't go to the hospital
So now
because
I
if they give you
understand.
injection, you will die. So the
Yeah.
ultimate thing, what happens?
No,
Yes.
but
So
you
what
know what?
happens? What happens is that before a cancer patient, sorry.
No, go ahead. No, I
So what
know
actually
because
happens
I
is this:
remember people
by the
used to say
time,
that in the
by the
villages.
time, yes. So by the
Yeah.
time, the reality is this: by the time a terminally ill cancer patients or a terminally ill patients for any other reason for that matter, by the
Yeah.
time they come to the hospital, they must have exhausted all forms of local care. The
Oh,
babalawos, the malams, the
and
churches,
nothing worked.
the
Nothing.
mosques, the traditional, they must have, nothing works. Then they
Yeah.
come to the hospital, and the next day the patient dies. They
Oh,
will say, we said it, we said it, we
yeah.
said it.
Yeah. So
so
I
so
would
so of
think
course
I
we
would
have
think
to
that
make
I
efforts,
would think,
you know.
I would think, Doc, the best thing is to focus on awareness, and focusing on awareness, we also have to
Yeah.
start from very young. and that is starting from local clinics, and educating, partnering with the imams and the pastors, because usually this religious leaders have a lot of influence over the community. If we're able to educate those religious leaders, they will educate the
Yeah,
parents. Even like the men can be sad and be educated that this is the reason. So I really think there's
yeah,
something here that we can actually shift it back to the community, and shipping it to the community is going through either the traditional rulers, or going through the religious leaders. Those are the two most powerful
yeah.
stakeholders in communities. I really have
Yeah,
learned a lot
yeah,
from this today. I didn't know that
yeah,
the cervical cancer is caused, is the one that is the most deadliest and most treatable, and we can eradicate that by giving vaccine to a girl before she hits 15, or by 15 years old, or if she had not
exactly.
had first sexual intercourse.
Encounter. Yeah.
So
Up
she
to
will
the
be
age
able.
of 25, it can be
Yeah,
taken. Yeah.
exactly. So I mean,
In fact, let me say this. Yes, let
yeah.
me say this. You
Mm,
see, the local people, the my grandpa and grandma in the villages may not be on this show, and
yeah.
they may not have the wherewithal to have access to social media.
Yes.
But the reality is that every one of us on this show today, either talking or listening,
Yes.
has a stake,
Yes.
in awareness
Yes.
creation,
Yes.
because it is the conglomerate of what we do, of our contribution to the society, that will change the cancer narrative in Nigeria. Now, every living person has a tendency to develop cancer.
So,
So nobody has immunity. Nobody has
against
immunity
cancer.
for cancer. Now, yes, now, cancer is not just cancer of the breast, cancer of the cervix. No, it's a disease entity that comprises of over 200 different diseases.
Wow.
In fact, every living organ of the body,
Can have
provided your cell is
get cancer.
dividing, is capable to develop cancer. Yes, because the cancer cells are the normal cells that are normally dividing, and as a result of a programmed process, when the time to die is due, they die. Now, cancer cells go haywire. They misbehave in every manner they want. They grow rapidly. They become so plenty. They encroach on the normal cells, become a serious nuisance. So every living cells can develop cancer. So that is why it is the responsibility of each and every one of us in this hall today to be a cancer advocate, to preach the gospel of early screening. Prevention, as I always say, is better, safer, and cheaper than cure.
So true.
You have our attitudes every day. Yes, our attitudes as individuals, we need
Hold it
to
there.
orient ourselves.
Hold it there.
Yeah.
Actually, that is my next question. In which demographic do you find most cases of cancer? Could it be age, gender, ethnic groups, or geographical region? So, you can actually like give us an idea.
Sorry.
Where do you find more of cancer in happening in Nigeria? And maybe you can shed some light on why that is the case.
Well, you see, the reality is this.
Yeah.
Cancer is seriously underreported in Nigeria.
Okay.
Seriously underreported. Now, look, the catch is that when you have more cases of cancers being detected, right,
Mhm.
it does not actually translate to that environment having more people that have
Okay.
cancer.
Okay.
Let's take an example. In the entire Northeast, there are only two viable cancer centers.
Okay. Entire
We
Northeast.
have the Federal Teaching Hospital in Gombe, And recently, we have the University of Maiduguri Teaching Hospital. Of course, all other tertiary hospitals are doing screenings for cancer, are doing treatment for cancer. But when we say a cancer center, we are
Yeah.
saying where you have everything under one roof.
Yeah.
Now, in the whole of my state, for example, you don't have one clinical radiation oncologist.
And what state is
These
that?
are the specialists.
And what state is that?
You want me to mention my state?
I'll pretend
Okay,
I
in
don't know
Yobe
it.
State, for example,
I pretend I don't
in
know you.
Yobe State, for example, in Yobe State, for example, you know,
Okay.
yes, look at if even Borno State that gave birth to us, you can
Yeah.
count the number of radiation oncologists they have, the specialists that are trained to treat cancer, to diagnose and treat cancer. Now, here is the misnomer. In the whole of Nigeria, in the whole of Nigeria,
Yeah.
there are less than, in fact, let me say 90 clinical and radiation oncologists in the whole of Nigeria, 90, less than 100. And 90%,
In the whole of
90% of
Nigeria.
these
In the
specialists
whole country.
in the whole of Nigeria, yes, yes, in the whole of Nigeria. And when you are talking about, one doctor to 500 or to 600 people, you know, the entire body of doctors, when you take the census and then divide it by the factor, you have like
Yeah.
one doctor to about 5,000 Nigerians, because Nigeria is a very big country in terms of
Yes.
population size.
Yes. Yes. Yes.
Now I want to say this: these clinical and radiation oncologists are mostly domiciled in urban areas. You go to Lagos, Abuja, Port Harcourt, that is where they are.
Hmm.
Calabar, maybe, that is where they are.
So
You don't
why
have them in
what's that,
rural
why
areas.
is that the
So
case? Why is that the case?
that is, well, maybe because number one, when you have the special, when you are a specialist, you don't have the right equipment or the right environment to work. You definitely will go and look for a greener pasture within the country. And
Yeah.
again, cancer is very expensive to treat. Very
Yes.
expensive.
Very.
People are dying because they don't have the money to treat cancer. Every day I get tons and tons of messages, because the mindset of our people is that every cancer patient that cannot afford to take care of himself, we have the president of the Nigerian Cancer Society, let's send it to him, maybe he knows somebody somewhere that will assist. Now, this is talking about basic treatment modalities, and the treatment modalities are in a step ladder approach. Somebody will treat his cancer for, let's say, 200,000. The
Mhm.
same kind of treatment in a sophisticated way will be given at 1 million naira. Now, cancer is a very expensive disease to treat. That is why when you look at, we have state-of-the-art cancer centers, but where are they? They are in Lagos, Abuja, Calabar, Port Harcourt. It is
First of
actually
all,
now
even to
that we are
get
having proliferation
accommodation
of
and all
cancer
of that
centers,
is
like
a
what
lot of
Kano
money.
State. Yes, yes. Like for example, you expect to see plenty number of cancer cases that will come out of Kano very soon in the coming years, because we have a state-of-the-art cancer center constructed by the immediate past administration in Kano State, and that
Okay.
is very functional now. Kano Cancer Center. Assuming
Okay.
if we can have that in every state, be rest assured the number of cancer cases we'll see will be the same across board everywhere, because you don't diagnose these cancers because there are no
You will
diagnostic
know they
modalities.
exist.
People are
You
not
will
going for
know.
screening. So the cancers are there. People are dying silently, but they are not captured in the statistics. So, but
But
there
they're
is
saying that
no,
uh,
not
you said the push.
yes. So
Uh,
to answer your question, there is nothing like breast cancer is more in this place than in this place. When they say prostate cancer is common in blacks affects every black in Nigeria. When they say breast cancer affects women of so age group, it's across board, it's everywhere. But having them on record is another thing, because a lot of women, breast cancer is one cancer that at stage 2, 3, obviously a woman has to go to the hospital. Where we
Yeah.
have major issue is cervical cancer, especially in women that are not married, that are divorced or widows. A woman will be having irregular vaginal bleeding and will be hiding it, keeping it to herself.
Yeah.
She will
Yeah.
not want to go for to the hospital, yes, not to expose
Yeah.
herself.
Wow.
Yes, because of the myths and misconceptions. Some will even say, look at this one, she's not even married, and she's
Oh,
having so this thing in her private organ, which means she has been doing a lot of bad things around. So women hide these things until when it is very late. Yes, for married women, definitely you cannot forever hide a foul-smelling discharge. You cannot forever hide irregular vaginal bleeding from your husband. So if the husband is a serious husband, he will be the one to push you to go to the hospital. But a lot of women are dying silently without getting diagnosis of cancer. A lot of people are dying. They will say is witchcraft. They will say angiophagy. They will
yeah.
say, do you know people slump and die because of brain cancers that they have been working around with for quite a long time. Suddenly they collapse and hey, NEPA took my light. Nigeria, welcome to Nigeria. So NEPA took my light, but I'm sure the generator will be on
Don't
soon.
worry.
So,
I laughed, right? The other day,
so,
my
so,
son
so,
was
so,
doing a
yeah.
FaceTime
So that
with
is
his friend in
so,
Nigeria. They took light. He said, can
yeah.
you
So,
imagine this
so,
disgrace?
so, yeah, yeah. So what I'm saying, what,
Yeah.
so what I'm
Well,
saying is
it's
essence.
okay.
What I'm saying is
We
essence is this,
understand.
and people are dying. People are dying silently, and people are dying silently, and most of the reasons for this attributed to other reasons aside from cancer.
Wow.
Somebody that has brain cancer suddenly collapsing, bleeding from the nose, bleeding from the ears, and then next he dies. They will say
So
angiophagy. They will
that
say that
in that
that
kind of case,
evil
it's brain
spirits are after
cancer.
him and all that. And that is the kind of narrative we are trying to change.
Yeah. So really,
It
honestly,
can be, yes, it can be, of course. It
so
can be, yeah.
the key thing here is a lot of awareness, right? The key thing is they're saying they can't see the
Seriously,
president.
my light is back.
Yeah, the president is back. The
My light
generator
is
is,
back. My light is back.
it's the
Yeah,
Nigerian factor. It's the
yeah,
Nigerian factor. At least thank God you do have
yeah,
generators, so we know you're able
yeah,
to come back quickly. But
yeah,
so right now,
yeah.
let me just go over a little bit. So first of all, you are saying the cervical cancer is really treatable when and it can be eradicated if people are even given vaccination, which could be the best is from 9 to 15 years. Did you say 9 to 15 years, both boys and a girl,
Yes, 9 to 14 years before
or
before the 15th birthday.
before the 15th birthday? So very important. Anyone watching this, you
Yeah.
can get your child vaccinated before the 15th year birthday, and that for sure will prevent them from ever catching cervical cancer. And there's one other thing that you also mentioned that people need to, I think it's important. We hear that all the time. Even when I was growing up in my village, actually, one of my uncles had that disease where you see his skin, like, it has all these rashes that don't heal at all. And they used to tell that they have done, he has a lot of cows. So they said his enemy is the one that put something on his skin so he can die. So I get it. So I'm sorry to
Yeah.
laugh, but exactly
Yeah.
what you're talking about.
And
You know, the thing-
like I said,
yeah,
any living cell can develop cancer. When you have this kind of skin disorders, that refuse to go away,
yeah.
and you keep on applying or using traditional concoctions, this and that, the constant irritation to the skin, the constant irritation to the cells will make them to undergo some certain modifications And of course, anything can happen, because some cancers have genetic. About 15% of some cancers have genetic factors responsible. So these things can happen, and before you know it, this thing can change. The morphology of the cell can change, and then they will begin to grow uncontrollably and they become cancer. And of course, even the ordinary infection I listed earlier, the necrotizing fasciitis, if left untreated, can give rise to a lot of other things, cause a lot of other,
So it
issues.
can mutate.
Can
You're
give
saying
you
it can mutate
rhabdomyosarcoma.
else. You are saying it can mutate to something else.
Sorry.
You are saying that the cancer can
Definitely,
mutate to
definitely,
something. Okay.
definitely.
So it does.
A normal benign growth, if left
Okay.
untreated or if not treated well, can transform into cancer. That is what I'm saying. Yeah.
Wow. 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 So now, is there a way you can tell us maybe how we can actually organize maybe some awareness? We have identified the stakeholders. The most important ones are the religious leaders and, of course, the rural, the traditional rulers. Is there a way that maybe we can, since you said it might be all over Nigeria, even not just one region alone, is there a way we can partner with different like communities or high schools, or maybe from primary school maybe to or middle school, to start maybe doing cancer talks? Because I think doing it in the
Very.
school, it can really help. Part of like the health education, we could do like a health education thing. We partner with
Yeah.
different primary school and
Yeah.
maybe have somebody that is from your organization, maybe or a doctor that can go out there and explain this the way you just explained it. I'd never heard that in my life, that this is actually treatable and there's a vaccine for it. See? And I would say I'm fairly
Yeah.
educated. You know what I mean? So imagine those people that are not educated.
Yeah.
So if we could,
Yeah.
maybe
Yeah.
if we can find, the whole idea of dialogue with Khuraira is finding experts or finding people doing great things and share it with the world. We are to share it.
Yeah.
Everybody watching this video today, please share this as many times as possible so that we can actually have people hear this. This is so important. If we are able to be through this interview we had with Dr. Adamu Al Hassan Umar,
You see.
the president of Cancer Society, can really enlighten few people and save lives, then this show had mattered. So it's important we have. And this another question that I have
Yeah.
you.
Yeah. You see.
So I think people, I
Yeah.
hear people all the time, they are saying, oh, wallahi abinci ne da ake ci. Abincin da aka ke shigo da shi ne ke kawo wannan wahalar. You know, meaning in English, is the food that is being imported or the food that we eat that is creating this rampant surge of cancer. Could you like educate us, since that is your expertise?
Well, thank you very much. Regarding the issue of collaboration, like you highlighted,
Mhm.
the major target in reducing cancer burden is through awareness creation.
Okay.
Because, like I said, 1/3 of most cancers can be prevented. 1/3 of most cancers can be treated if detected early. That is already 2/3.
Yes. Yes.
That is already about 60% of most cancers. So this
Yes.
is why collaboration, partnership is very important. Let me say this. There is an organization that has a Nigerian root that is based in Australia. In Nigeria, and working on before the ROE campaign, our youth campaign,
Can you repeat that? I think you got a
our
call.
youth.
I think you got a call. We couldn't hear what you're saying. And you know what you
Okay,
could
okay.
do?
No, I was
You
saying
know,
that when you are talking about collaboration,
you know what you could do?
okay,
Can
maybe
you
the
put your
network, maybe
phone?
the network
Can you
fluctuated.
put your phone
Let's,
on
yeah,
off focus. Can you take it off so calls will not come in?
No,
If you
I'm not using my
you're not
phone.
using,
I'm
is
not
it
using
just
my phone.
network?
I'm using my
Okay.
computer,
Okay, so I guess it then it's the Yobe network.
and I'm using it's the network
Okay.
in my village or the witches that are trying to get at me.
Okay, no problem.
So can
So
you hear me now?
repeat what you said because
Can
we
you hear me
couldn't
now?
hear. You were
Yes,
mentioning something that was
yes,
very important, but we couldn't
yes.
hear you. Can you repeat it,
Okay,
please?
can you hear me now? Yeah,
Yes, we can hear
yeah.
you.
Can you hear me now?
Yes, yes.
Can you hear me well now? Very good. So what I was saying is when you are talking about collaboration, when you're talking about collaboration, when you're talking about partnership and talking about what can we do, how do we collaborate to
Yeah.
create awareness, to create some interventions like basic screening services in the communities. This is what
Yes.
we do. This is what is happening every day. So I was citing an example with a certain organization that is based in Australia, and he has roots here in Nigeria. Founded by a professor. He's a professor of family medicine at Griffiths University, but he's doing very good job. Now, when he came into the Nigerian Cancer Society, he was already running a program that is called the Arroy campaign, Arm
Okay.
Our Youth campaign.
Okay.
Now, the Nigerian Cancer Society keyed into that because there is value addition for
Actually,
our
you guys
youth.
can post in
Is
one
targeted
second.
at,
Rufai, people are asking if they can ask the
sorry,
president questions. They want to ask you questions. So after you answer this, maybe you can give them time to answer some of their
yes,
questions. Some of the viewers want to ask you questions, sir. So go ahead, sir. After he finish explaining this, then he can answer the questions. You can
that,
post the questions
yeah.
or
So let me say, yeah, yeah. So let me conclude on what I was saying. Now, the
yeah.
Arm Our Youth campaign, the Arm
Mm-hmm.
Our Youth campaign is targeted at NYSC Youth Corps members.
Okay.
We had structures across the entire NYSC camps in Nigeria.
Okay.
And during every NYSC orientation camp, our volunteers go to talk to these NYSC Corps members on the anti-breast and anti-cervical cancer Okay, sorry. Can you hear me now?
You're back now. We didn't hear you for a second. So you were saying that they go to NYC camps, and that was the last time
Hello?
we
Am
heard.
I audible? Can you hear?
Yeah, we can hear you now.
Yes, yes. So the target, yes, the idea is that they the sense is for them to go and educate the secondary school students that they will be teaching during their service here.
Okay, I see.
And
Oh, that's
the,
really
the,
good.
the, the larger magnifier effect of that, yeah, the larger magnifier effect of that is awareness creation.
I
We
like that.
sponsored a bill. We sponsored a bill. We sponsored a bill to the National Assembly. A bill introduction of teachings of anti-breast, anti-cervical cancer into the curriculum of secondary schools in Nigeria.
Great.
Now, the National Assembly, in its wisdom,
Mm-hmm.
expanded the bill to include anti-breast, anti-cervical, and healthy lifestyle teachings in the curriculum of not only secondary schools in Nigeria, but also colleges and polytechnics. And the bill passed both chambers of the National Assembly and was sent to the president for assent before the tenure of the last president ended. And we are still
Okay.
expecting that even if the bill comes back, it may still go
Mm-hmm.
back so that that bill can be adopted, so that it will be compulsory for teachings for anti-breast, anti-cervical cancer teachings to be inculcated in the minds of our young children. so the healthy lifestyle habits can be taught to secondary schools, polytechnic colleges of education students. Now you see now it's a common thing on the streets in Nigeria. You see people buying suya every day, suya that has
Yeah.
been prepared with burnt tires,
Yes. Oh,
burnt tires. And you know there are a lot of
really?
carcinogens that are contained in these chemicals
That
that
makes me not
come
eat suya when I
from
go to
car tires.
Nigeria now.
Yes, yes. And you see Bomo, you see the way they are preparing. You
Wow.
see the way Bomo is being prepared. They use burnt tires and all this, and people buy these things because they are garnished, they are spicy, and they are eagerly excited eating them, not knowing that
Yeah.
they are
Yeah.
ingesting a lot of carcinogens into their systems. Yeah. So collaboration towards awareness creation is very important. Mind you, 80% of Nigerians are paying for healthcare out of their pockets. 80%. In fact, it's
Really?
86% now,
Really?
according to the latest statistics.
So
86%.
where's the money going if they're
Yes,
paying for healthcare?
86% are paying for healthcare out of their pockets. No, the reality is that the money is not there. Money is not there. Nigeria was the host of the Abuja Declaration of 2001,
Yeah.
where all African Union countries met in Abuja at the International Conference Center and agreed that the minimum allocation to health from the consolidated budget should be a minimum of 15%.
Okay.
15%.
Mm-hmm.
Since the year 2001,
Mm-hmm.
Nigeria's health budget it has never crossed 78% mark. We are talking about minimum of 15%. Now, without budgetary allocation to healthcare, there is no way you can achieve maximum equipping of our primary healthcare centers. There is no way you can achieve, universal health coverage for Nigerians. Because when the healthcare system is down, when the primary healthcare system that is supposed to be the first point of call for every patient is down,
Yeah.
when it is decayed, what do you have? You have a vicious cycle. Nothing happens. It's now that as advocates, we are optimistic because I was in a program recently where the senior special advisor to the president on health broke the news to us that day that the current administration has earmarked to start consolidated allocation to healthcare from 10% as from the 2024 budget. And it's only
Wow.
when you have adequate funding for healthcare that you
Yeah.
have adequate health interventions. Now, the National Health Insurance Authority, so many Nigerians are not aware as at today that insurance cover, just like in the UK and America and all other developed countries, insurance cover now in Nigeria is compulsory. A lot of Nigerians don't know.
Good. So
A
at
lot of
least I
Nigerians don't
hope
know
it is
because
used
the
to
national
this.
health issue,
No, I'm saying I
the
hope it is
National Health
used for what it
Insurance
is intended for.
Act was amended. That is another problem on its own.
Yeah.
Because let
Yeah.
me let me land on this. Let me land on this.
Mhm.
The National Health Insurance Scheme, the bill was amended. The act was amended last year.
Okay.
It's now National Health Insurance Authority, an autonomous government body. Now, in the new act, there is a provision for what we call the Vulnerable Fund that is supposed to cater for about 72 million Nigerians
Okay.
in the category of the elderly, the very young, the indigent ones in the society. Now, health insurance is supposed to be compulsory on all Nigerians, but as we speak today, maybe only 11% of Nigerians are covered by the national health insurance because it's mostly the federal government workers that are covered under the National Health Insurance Authority.
11.
States now have state health insurance authorities, but the reality is that most of the state health insurance authorities are not optimally functioning. So now, the idea is without adequate health coverage, without provision of screening services, awareness alone cannot cover the gaps, cannot close the gaps.
True.
And this is why we encourage organizations that are doing awareness to also factor in screening into their interventions, and
Okay.
not only factoring in screening, also factor in some provision for immediate care to any patient that will have cancer. Let me tell you something. Recently, there is an organization, one of our member organizations from Lagos, that was in Niamey and Portisco, that was in
Mm-hmm.
Yobe State, to
Mm-hmm.
come and do cancer awareness, breast and cervical cancer screening.
Mm-hmm.
And the program was funded by a pharmaceutical company in collaboration with an international NGO. They came and spent about 4 days in the localities, educating women on how to do safe breast examination, educating women on their need to go to hospital for any sinister symptoms that they may notice and all that. So
Mm-hmm.
if we can have that round the clock, it will go a long way in addressing a lot of these gaps. Even if at the end of the day we may not be able to cater or may not be able to take care of the patients that will be positive from this kind of screenings, at least it will address a lot of challenges. It will address the issue of late presentation, because people will now be aware, people will now be ready to go for screening. And of course, cases of cancers will be detected early. Like in the case of cervical cancer, like I told you, even at precancerous stages, because when a precancerous lesion is detected in the cervix, there is what we call simple procedures that will be done, to
And it's
to
gone.
to to take care of that, precancerous lesion, and the woman is free and saved from dying early as a
So
result
this
of cancer. So a lot of things we
you
can
have
do,
mentioned
to kind.
a lot of great things. I want to give our audience a chance to ask you questions, and we want to keep this at an hour, but I think that since you have said so many things and some of our guests want to ask you questions, I don't want to piss them off so they don't say they're not coming back tomorrow. So probably we'll go a little bit over an hour. So I don't know who wants to ask question. Can you read
Yeah.
some of the comments? What are the causes of breast cancer? So somebody asked, Patrick Matthew said, what are the causes of breast and cervical cancer? Why it's that most Nigeria don't discover it early? I think he had answered that. Well, Doc, do you want to
Yes, yes,
touch on that?
yes. Exactly. It's actually the same thing that we have been talking about.
Yes,
You
you
know,
had
lack of
addressed a lot.
awareness. When
Yes.
you are not aware, and you are a woman, that is above 45, and then you have these episodes of irregular vaginal bleeding, foul smelling discharge. They will be telling you, for those people that you will confide in, they will tell you, no, it's your Kishia, oh, it's
Yeah.
your Kisha,
It's true.
it's
It's
your
true.
in-laws.
It's true.
They don't want you to succeed. They are not comfortable that you are happy with your husband.
That's true.
So don't allow them. Let me take you to one malam, or let me take you to one babalao, and that is where you have the delay.
So true.
In some women, they are not even aware that
Yeah.
when you have a vaginal bleeding, the first thing you are supposed to do is to go to the hospital. They will
True.
think it's something supernatural, and they will be there. And before you know
So
it, it will progress. And progressing from stage 1, 2, 3, 4 is not
it's so fast.
something that will take years. So yes, yes. Once it is not arrested at that very early stage, it progresses rapidly. It
Wow.
progresses rapidly. So, myths and misconceptions in the society, illiteracy, poverty, you know, religious and traditional taboos, of course, in line with myths and misconceptions, are the reasons why cancers, not only cervical cancer, are mostly present to the hospital late.
Yeah.
And of course, when
Wow.
you have late presentation, the outcome is not always favorable. You know,
Wow.
so it's the same cycle.
So early detection,
See
awareness,
somebody,
and
ma-
mm,
mm,
Oh, you can read the questions, right? So you can
Very
answer some of
important.
them. Okay. And I
Yeah, no,
think
no, I
Ruth,
saw
some people want to know if they
someone
want
is
to
talking.
come in. I don't know if you can let some people, can they just write the questions and you answer, or they want to come
Sorry?
in? And no, somebody is writing, is that, are we allowed to come in? Is the moderator gonna let us in to join the live?
Someone.
So I think we have, is that your one of your people, Eunice Ali? Is she one part of your organization? Doc,
Sorry?
Is Eunice Ali a part of the organization as well?
Sorry?
Eunice Ali, is she
Yes,
part of
she
your
is. She
organization?
is. She is.
Okay, I just asked.
Yes,
We
she
want to
is.
hear a
Mm.
woman's voice. Can I bring her in to just
Yes,
some
yes.
good?
She's one of my.
Okay, all right. So yeah, we want to hear, because it's good also to hear as another female, a female, talk about it.
Please do.
Yeah.
Please do.
Welcome to Dialogue with Khuraira,
She is
Eunice.
one of our chief one US organization. Alongside myself, two of us
Okay.
were picked from Nigeria to come to Kenya,
Okay.
and in the storytelling, Ines, how come we're wearing the same shirt today?
Oh,
We
of
are
course.
representing the Nigerian Cancer Society.
Yeah.
We are not in the same
Welcome
place.
to
We are not
Dialogue
in the
with
same
Khuraira.
place.
If you want to say a few
I
things.
am in Abuja.
Yeah, so if you want to say a few things, please go ahead.
Okay, I doctor has said everything. He
Yeah.
has really explained everything. So I don't really have anything much to say. I can just say we just need more advocacy and more awareness.
Okay.
That is just what I think we need, more advocacy. We can never have enough of advocacy and awareness. So I
Okay.
think that's the major thing we need right now, because the cancer thing, so many people are not aware of anything. Even the educated ones, they are not aware of anything about cancer. And it's really, really killing faster than even the cancer itself. So they said information is power.
Yeah.
When you are well informed, you can know how to protect or go about certain things. So,
Yeah.
but I know my president has done justice to everything.
Oh
So,
yes, he did. He
yes,
did an incredible job on that.
I wouldn't want to spend much time. He has done everything. So, I just
Thank,
advocacy awareness. Thank you.
Thank you so much, Eunice, for
thank
joining
you.
us.
Thank you.
Yeah. So, Doc,
Knowledge,
I think if there's
knowledge is power.
yeah,
Yeah,
exactly.
Mm.
So, Doc, any other questions that you want to
knowledge is
answer
power.
on there?
Yeah.
Somebody is saying that is taking energy drink serve as my
Um,
daily routine. Doc, what are
I saw
side
it.
effects? Did you see that?
Energy drink.
Yeah.
Energy drink. Well, actually, the Nigerian Cancer Society. Can you hear me?
Yeah, we can hear you.
Hello.
Yes.
Aha. The Nigerian Cancer Society is myself. I'm a co-chair of the National Action for Sugar Reduction. The National Action for Sugar Reduction is a coalition of non-governmental organizations and actors in Nigeria that are championing the introduction of sugar tax in the country, and that are also advocating for, reduction or even cessation of ingestion of all these sugary products. I am very much sure that the person asking this question is very much aware on the amount of sugar that is in a lot of these energy drinks, and not just sugary drinks. The energy drinks, most of these energy drinks they are talking about, have a
Yeah.
lot of caffeine in them, and we know the effects of caffeine, on the brain, the effect of trying to activate the brain to stay alert, and of course it is effect also on the digestive tract, ultimately giving rise to gastritis, peptic ulcer disease, and rapid gastric emptying time, because nicotine stimulates gastric motility. So there are a lot of factors that are embedded in excess consumption of these energy drinks that are in the long term hazardous to the individual, because it will distort your physiology, the physiology on how your system works. And only God knows, when you have a certain drink that will go and be stimulating, the rapid movement of your bowel, only God knows. And the rate and rise of colorectal cancer these days is on the increase. And so many things can happen, because we said it, when the cells are overworked, they tend to go out of
Yeah.
the normal and begin to replicate abnormally. So there my mama died of cancer sometimes. Okay. Okay, so I'm sorry to hear that. So Madam President, let me say something. Probably, I have noticed that even in the cycle of our cancer advocates, a lot are not aware that there are government interventions
Okay.
for indigent cancer patients in the country.
Okay.
And
Which indigent?
sometimes
Break,
when
break
we
it
bring
down
the
so they
people
understand what indigent means. Maybe some people don't understand.
exactly,
So break it down, oh,
now now
the bare
now
minimum.
yes, an indigent cancer patient is someone that is below the the poverty bracket, someone that cannot afford to spend more than $2 a day, and someone that is usually, from the rural areas, uneducated, don't have very vast to benefit from this indigent cancer fund. The federal government has a provision in we call the Cancer Health Fund, CHF. This Cancer Health Fund is targeted at indigent cancer patients. For now, is in 6 regional hospitals across the country, one in each of the geopolitical zones. But there is plan to expand it, especially now that we have a national cancer treatment and research institute. Now, a cancer patient, based on recommendation from his clinician, can benefit from the Cancer Health Fund and will get a relative or a friend to fill the form online. And once that patient meets the criteria, that patient will be enrolled into the program. Don't forget, the social welfare department of that hospital will do a background check on the patient to know whether truly that patient is indigent. We have referred many patients to places like Gombe, and they have gotten interventions. Once you are enrolled into the program, federal government will take care of your treatment, from
And they go,
surgery to chemotherapy to
do they go to the
radiotherapy,
local government? Where do they go and register? Where do they go and
sorry.
register? In case I miss it, where
That
can you repeat where
for
they go to
now,
register?
yes, yes, it's online. Registration is done online. So
Okay.
this is what we do. For you to benefit, you have to go to the one of the 6 regional hospitals. But let me give you an example. For example, there is a patient in my hospital that is indigent. Now, probably those of us working there will have to contribute money to give that person to transport him or herself to a place, to Federal Teaching Hospital Gombe, for example. Then a referral letter will be written to that patient. When the patient gets there, gets accepted into the hospital, and they probably, even before the patient goes, somebody will fill that form online, so that by the time he gets there, the process has already started. We
Okay.
have 6 centers, like I said. In Northwest, we have National Hospital Abuja. In the Northwest, we have the Ahmedu Bello University Teaching Hospital in Zaria. In the South, we have University College Hospital, Calabar. In the Southeast, we have University of Nigeria Teaching Hospital, Enugu. In the Southwest, we have University College Hospital, Ibadan. And in the Northeast here, we have Federal Teaching Hospital, Gombe. But there is a plan to expand it, because, like I said, for the first time in the history of Nigeria last year, the National Institute for Cancer Research and Treatment came into effect. There is a robust plan in motion now to address disparities in cancer in Nigeria, to address the diagnostic gaps in Nigeria, to address the treatment gaps in Nigeria. And the NICRAT is a new institute, is gaining attraction from all over the world. all international organizations in addressing cancer in Nigeria. And luckily for us, the Pioneer Director General is one of us. In fact, he's the current Assistant Secretary General of the Nigerian Cancer Society. He's a professor of clinical and radiation oncology, Professor Usman Aliyu Malemi, and he's already doing wonders. So we expect to see, a drastic increase in the number of cases we see. Why? Because there will be improvement in diagnosis, there will be
Yeah.
improvement in screening,
And
and
I hope
definitely
drastic treatment too, I hope.
we expect to see in the outcome, because there will also be improvement in treatment. Now,
Wonderful.
again, that people are not aware of. That one is more expanded. Is in a lot of tertiary health centers in Nigeria. It's called the CAP, Cancer Access Program. It's a partnership between the federal government and a pharmaceutical company.
Okay.
Now, it's about chemotherapy. That one is about drugs for treating cancer. Now, well-to-do individuals that are not indigent can afford to pay 50%, then government will pay 50%. They get these drugs at subsidized rates from this pharmaceutical company, and then they give them to patients at 50% discount.
Okay. That's
Again,
wonderful.
there is another intervention between the same pharmaceutical company and the National Health Insurance Authority. Even though National Health Insurance Authority has some form of cover for cancer, but not all aspects of cancer are covered, because cancer treatment, like I said, is very expensive. So there is also this agreement, cost-sharing agreement between National Health Insurance Authority and that same pharmaceutical company, where National Health Insurance Authority will pay 50%, the pharmaceutical company will pay 30%, the patient may end up paying only
Only
20%.
20%.
And so many health insurance patients, so many people on the National Health Insurance Authority, in the National Health Insurance, are not aware that that kind of treatment modality exists, and people need to know. And it is
Exactly.
our
So,
role
Doc,
as advocates to
I
bring
think
this kind
next
of
time what I'm
salient.
going to do,
Yes,
what I'm going to do next time is you're going to come and host a show that we can actually do where people maybe will write questions and you can just talk about what is available, where people need to go. This is very, very important. What you are saying, a lot of people don't know about that. So I
please,
don't mind you coming to do another show to
sure,
talk about that. But before we end this show,
anytime,
can you please
anytime.
address Abba Dahiru Abakar, his question here? Can you please address him? Thank you. He's the one with the 7 siblings.
Abba Dahiru Abubakar is
Yes.
siblings as my sister. What guided advice you should offer me to pass on to my sisters, please? I am sad. I want no more cutting of their breast further. Exactly. The idea is that is not cancer is not only women. Oh. Don't forget, even breast cancer. 1% of men develop breast cancer. Oh. One
Really?
percent.
Never knew that.
1% can be negligible. 1%
Wow.
can be negligible, but that 1% can be anybody.
Yes.
So, but of course, mostly women. The secret with breast cancer is that it is the simplest cancer to detect. Once a woman has reaches the pivotal age, there is proper, what do you call this? Is it sex education, or what do you call it?
Yes.
In
The
that
certification.
that thing about the reproductive system. Yes, once a young girl is aware of, and she's conscious of her reproductive cycle, of her reproductive age, because even as a parent, you don't just wait until your daughter starts to menstruate before you give her life or lifestyle education on what to expect when that period comes, when she will begin to grow breast, when she will begin
Yes.
to have the menstrual flow monthly and all that. You need to prepare her mind ahead. So the same thing, once young girls and women, is every woman, whether you are 40, whether you are 60, whether you are 70. Self breast examination is a panacea to detecting precancerous lesions of the breast. And it's very simple. And there are demonstrations everywhere. You go to Google, you go to YouTube, you have several demonstrations on teachings on how the woman should stand in front of the mirror, on how to palpate the various quadrants of the breast, to share the breast into four, palpate this one up to the axilla, because the breast, the breast extends into the into the armpit. There
Yeah.
is a tail of the breast that goes into the armpit. So when you are
Yeah.
palpating, you don't just palpate here, you palpate up to the armpit, because there is a tail there. You palpate
Okay.
it quadrant by quadrant. If a woman is used to this every day, the day she will notice a change, because breast mouse, we call it breast mouse. There is, mouse, this thing
Mhm.
that moves around. So
Yeah.
if there is a fibroadenoma, you will detect it, it will move. Yeah. But mind you, pregnant, lactating mothers, breastfeeding mothers usually have these
Lumps.
glandular tissues from the yes, those ones are not lumps. So
Yeah.
breastfeeding mothers can have some lumps in their breast, but they should not be afraid, because those ones are not tumors. They are just breast glandular tissues as a result of the milk secretion and all that. So once there is a breast mouse, it's as simple as ABC. Presentation to the hospital, it will be removed and it is gone for good. So it's
Wow.
very important. Every woman above the age of 40, should go for a mammogram. Mammogram
Okay.
is like an
Is
X-ray
it
of the
once a
breast,
year or twice a year? Once a year or
like an
twice a year?
X-ray of the breast. At
Is
least
it
at
one?
least once a year.
Okay.
At least
Okay.
once a year. Sorry?
Okay.
Yes, at least once a year. There are some
Okay.
organizations. There are some organizations that do come to do this free of charge during
Okay.
screening and awareness campaigns. But
Yeah.
this thing is available in a lot of hospitals. A lot of hospitals, you have these mammogram machines
Yeah.
donated by certain organizations, and they charge little to do it. In fact, in some hospitals, it's free of charge. I remember in my hospital last year when they were commemorating World Radiology and Radiography Day, they did mammogram free of charge for 1 week.
Oh, wow.
So
So,
early screening is very important. And once
okay.
it's detected early, even if yes, yes, I can hear you.
No, no, no. I said wonderful. That
So
I'm
that
agreeing with you.
we don't have to subject women to go through the ordeal of having their breast cut and all that. But of course, we have very beautiful prostheses now, bras that women use, you know, because we always encourage our survivors to live positively. And
Yeah.
the
Yeah.
the, the physical attribute, is a very important aspect of
Aspect of the
confidence
woman.
building and acceptance by society and all that. So there are a lot of support programs that we have in our cancer survivorship programs. In fact, there is one lady that has an NGO, a technology company that is working with us now. She
Oh,
developed a bra. That can detect lumps in the breast.
really?
Yes, she developed a bra. Smart. It's called Smart Bra. Yes, Smart Bra.
Where are they selling
She is
that?
one of our very aspiring and hardworking CEOs.
Okay. So this is what we're gonna do,
Sorry?
dog. This is what we're gonna do, Doc. There is so
I
much
think,
information
yes, ma'am.
that you have put out,
Yeah,
and this is very, very vital
yeah,
to our society.
yeah,
And Eunice is here. Is there a way
yeah.
that you can actually, like, maybe do a really some important point? Because what is going to happen? Rufai Bello, who is our content manager, is going to edit this, post it on YouTube, and then also send the link again on Facebook for those people that have missed the show. So what we're going to do, all your points will be under that video so that people can actually really take advantage of what you have said, because maybe they might have network issue and they are not able to download the YouTube video to watch. But if this important point that you stated, sir, will really be helpful for us to have it, so they can see it as a glance, and we can encourage our members to share it, because this can be a life saving episode for many, many people. For one, I want to get that information of that woman with the, the lump, detecting lump bra. I want that information, and I would share it on my Facebook page for more people to take advantage of that, to find to be able to get that. So what I'm going to say, I have to end the show now, and be rest assured, everybody, I'm seeing really great comments here, how everybody is happy. You were very thorough and you explained a lot, and I honestly, not just our dialogue with reference, me myself, I've learned so much today from what you have shared. So thank you, thank you, thank you, thank you so much for your time, Doc. I know you are super busy, and it's kind of probably almost bedtime in Nigeria. Who knows? So I really appreciate you. Thank you, Eunice, for joining us, and also a lot of our people. I see you here, and our content manager, Rufai Bello. Thank you so much. You can come on camera to say hi to everybody before we leave. And all our viewers, thank you, thank you, thank you. We really appreciate you. And we will be bringing another person. Next week, we're going to have another guest. So thank you. Thank you.
Thank you. Thank you, Madam
Mhm.
President. Thank you.
Thank you also.
Okay.
Thank you. It's always a pleasure.
Me too. Thank
And
you so
well
much.
done, well done on the fantastic coordination of the, well done on the fantastic coordination of the Arewa Development Support Initiative that we are all members of. And I want to believe that Arewa Support Development Initiative will go into partnership with either the Nigerian Cancer Society or any create some impactful messages, some
Yes.
impactful, reach to the common man and woman in our remote communities.
Yeah, I think we should put something together, and where we can discuss it with management, and to see how we can really get, we are in literally in 19 northern states. This will be a very easy way to kind of share this information. So please put, like I said, put all that information that you shared into writing. We can even share it on our
Definitely.
platforms and ask everybody to share it, and share it to other platforms, and let's try and save lives. So thank you, everyone, and have a wonderful night. Thank you, everybody.
Good night. Good night, everyone.